begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now today I'd like to discuss high blood pressure and the common cold. In one of my recent chat sessions on the Acupuncture is My Life app, I was asked, does blood pressure go up when you catch a cold? Now, the person was pretty concerned because we're headed into cold and flu season while in the midst of the present COVID-19 pandemic. Now, if you wish to hold a private chat with Acupuncture is My Life regarding any ailments you or a loved one may have or may be dealing with and would like to know if acupuncture can benefit you, simply go to the Google Play Store and download the app. Now, back to the question of whether your blood pressure can go up if you catch the common cold, and the answer to that is yes, it does. You see, any type of stress on the body, in this case, catching a cold or emotional stress, can cause an increase in blood pressure. Once you're sick with an infection and your temperature rises, as in fever, your body's immune response presents with increased inflammation in the body, which leads to an increase in blood pressure. Now, if you've been diagnosed with hypertension, this is not necessarily good. You see, the changes of seasons can have an effect on blood pressure. As the weather turns colder, your blood vessels tend to narrow, thereby increasing the amount of pressure needed to pump blood through the more narrow vessels throughout your body. Now, most people, especially hypertensives, do not realize that sudden changes in the weather, such as like wind, hot or cold fronts, changes in humidity and storms, can adversely affect your blood pressure. As flu and cold season approaches, it's best to continually monitor your blood pressure, especially if you decide to take any over-the-counter medications to combat your cold symptoms, because pseudoephedrine tends to be a big culprit as a cold medicine ingredient, so be sure to consult with your physician before taking any over-the-counter medications for the common cold. Now, when it comes to Chinese medicine, any type of medicine a patient may be taking can cause severe imbalances from a yin and yang perspective. Like, for instance, let's take a look at diuretics. From a Chinese medicine perspective, long-term use of diuretics can injure yin, thereby causing yin to become deficient because it removes fluids from the body, whereas an acupuncturist has to be aware of this as a side effect, like when doing pulse diagnosis. Then there's beta blockers, which can cause yang to become deficient, leading to chronic cold within the body. ACE inhibitors tend to cause yin to become deficient, especially lung yin, as it also impedes the descending function of lung qi as well. Then there's angiotensin II receptor antagonists, which mildly contributes to yin becoming deficient. Calcium channel blockers tend to injure kidney yang and heart blood. So in Chinese medicine, the three major organs that are involved when it comes to high blood pressure are spleen, kidney, and liver. If you have not seen my episodes on the basic functions of the spleen, kidney, or liver, please take a moment to view them to get a better understanding of how chronic conditions such as hypertension can cause a deficiency of liver and or kidneys and spleen. Now, recently I had a case of liver wind where the patient was diagnosed with hypertension and experienced headaches on the temple areas of his head with dizziness, vertigo, high systolic blood pressure, unilateral numbness of the limbs with insomnia, blurred vision, and irritability. To an acupuncturist, this would be considered more so a type of qi level hypertension, where the pathology tends to present more in the head and neck of the body, so I knew I had to extinguish liver wind. So I needle points on the liver, spleen, and stomach channels to extinguish liver wind and nourish liver blood and liver yin. I also needle points on the Sanjiao and large intestine channels to extinguish liver wind and regulate the ascending and descending of qi. I needle points on the gallbladder channels, the kidney channels as well, and on the governing vessel to nourish kidney yin, nourish the blood, and extinguish liver wind. Now, this patient comes in on a regular basis along with seeing his primary care physician and appears to be doing quite well. But for those who come down with a cold, before taking an over-the-counter medication of any sort, please consult with your physician first, as well as paying a visit to your local acupuncturist. Now, if you have any questions regarding the common cold and high blood pressure, simply go to the Google Play Store and download the Acupuncture is My Life app to hold a private chat to discuss any concerns you may have and how acupuncture may benefit you or a loved one. But in the meantime, don't forget to subscribe to this channel. And until next time, acupuncture is my life. What's yours?